Good morning, everyone. Welcome to the second session of Eye Care Hour, a webinar series by Dr. Agarwals Eye Hospital. We're so excited to have you with us today. As we wait for a few more participants to join in, let me give you a brief overview about Dr. Agarwals Eye Hospital. Dr. Agarwals is proud to be India's largest eye care services with a strong legacy of over 60 years in providing trusted eye care. We have a presence of 250 plus facilities across India and Africa, and we perform more than 2 lakh surgeries annually, catering a number of 2.1 million patients with a strength of 800 plus doctors and 1600 plus paramedical staff. So we have a comprehensive services offering categorized into surgeries and non-surgical treatments. For surgeries, we have cataract, refractive, which is LASIK, SMILE, retinal injections and vitrectomy, cornea transplantation, glaucoma surgeries, eye and eyelid plasty, that is oculoplasty. For the diagnostic and non-surgical treatments, we have refraction for eye power, eye pressure check, pre-LASIK measurements, lens power calculation, retinal diagnosis, retina laser therapy, and dry eye treatment. I'll just give you a brief overview of how a typical patient journey is at Agarwal's Eye Hospital. So when you walk into the hospital, typically the process starts with the registration. First, you go to the reception counter and register as a patient. Second is the optometrist checkup. Then you meet the doctor, where doctor consultation takes place. If you are heading for any surgical advice, then you will be taken to the counselor, where the surgical procedure and the procedure plus the do's and don'ts and pre and post operative cares are explained in detail via one-to-one conversation. Then the patient is taken to the diagnostics for surgery and recovery. Since eye care surgeries are a daycare procedure, the recovery is on the same day and the discharge is also on the same day. If you are going for a non-surgical treatment, directly from the doctor consultations, you head to the optical stores or the pharmacy, and that ends the patient journey here. So we'll give a small video about with Sachin Tendulkar, who is a brand ambassador.
Thank you, sir.
Oh my God, Sachin sir. Sir, I'm your biggest fan. आपके straight drives और pull shots. Wow. Sydney वाली innings. Just magic, sir. अपनी शादी वाले दिन I was watching you bat. सर, जब से आप रिटायर हुए हो, मैंने तो घर से टीवी ही हटा दी. आपका डुप्लीकेट भी इधर. What a coincidence. एक सेल्फी.
Mr. Tendulkar, your car is here. कैटरैक्ट जितना बढ़ेगा, विजन उतना घटेगा. डॉक्टर अग्रवाल आई हॉस्पिटल में आज ही अपॉइंटमेंट बुक करिए.
Here's another video featuring Sachin Tendulkar and Glenn McGrath.
Hey,
You still upset about Adelaide?
I wasn't out, and you know it.
Look, mate, it's Emma.
Ball hits the shoulder, and right away, McGrath is appealing for an
Obviously, it's
FW.
not.
How?
It's clearly missing the stumps. I think you need to get your eyes tested.
My eyes are perfectly fine, okay?
Excuse me? This is my seat.
3B.
It's 3D.
कब से बोल रहा हूँ इसे आई टेस्ट करवाने के लिए.
टाइम पे आई चेकअप नहीं कराएंगे तो पछताएंगे. डॉक्टर अग्रवाल आई हॉस्पिटल में आज ही अपॉइंटमेंट बुक करिए.
This is our today's speaker.
डॉक्टर अग्रवाल्स आई हॉस्पिटल।
सबको पता है चश्मा हटाने की लेसिक सर्जरी मतलब डॉक्टर अग्रवाल्स आई हॉस्पिटल।
डॉक्टर अग्रवाल्स आई हॉस्पिटल।
सबको पता है चश्मा हटाने की लेसिक सर्जरी मतलब डॉक्टर अग्रवाल्स आई हॉस्पिटल।
So this is Dr. Smit Bavariya. He has an experience over a decade of experience across India and African countries. Dr. Smit Bavariya is known for his precision and patient-centric approach. Trained under LASIK expert Dr. Vandana Jain, he specializes in delivering advanced result-oriented vision correction. He has he has an expertise or skilled in femto, contoura, smile, and standard LASIK. With performed over 1,000 plus LASIK surgeries and extensive surgical experience across African countries. So now we'll kickstart our main event, our webinar, Ditch the Specs, Discover LASIK, conducted by our expert Dr. Smit Bavariya. Dr. Smith has been a part of Dr. Agarwals Eye Hospital for a decade and has served in various African countries. It is rare that we come across a person like Dr. Smith who appears to be on a mission to provide his patients not just treatment but an incredible eye experience in the eye care treatment. The spark in his vision translates into the sparkle in the eyes of his patients. Before we begin, I'd like to remind everyone that we have a special offer on LASIK checkup for the attendees. So make sure that you stay tuned till the end of the session and know how to avail the same. Over to you, Dr. Smith.
Thank you, Kavita, for the nice introduction about myself as well as the Dr. Agarwals Eye Hospital. I'll just share my screen and we'll straight away start our presentation for the LASIK today. I hope I am audible enough. So today's webinar is on Ditch the Specs, Discover the LASIK. The whole idea of today's webinar is to give details regarding LASIK surgery, how it is happening, and how we can take up the options of LASIK surgery. So this is basically the normal eye structure. You know, our eye is the best camera in the world. God has created a camera which is the best in the world. The eye has the front surface which is called cornea. The cornea captures the sorry. Sorry for the glitch. So if you see, the eye has mainly three portions which is very much important prospect for the vision. The first, the frontmost part is called cornea, and the cornea captures the light, focuses on the lens in the center of the eye, and this lens particularly, which is considered as a crystalline natural lens, which becomes later on in the life cataract, focuses the light onto the retina. And so cornea, lens, and the retina, these three are the most important aspect of the normal vision. Same like the aperture of the lens and the film of the camera. So for having a perfect vision, you know, all the rays which is coming from outside should be getting focused perfectly on the center of the retina. So then and then we will have a clear vision. So if you see the picture on the left side, lady in the front, the guy in the back, everything is clear in perfect measure. Now, what are the different abnormalities in the vision which we see in a daily life? First, the most commonest is the myopia. Myopia, we also use the word short-sightedness. It means a person is able to see the closer things and not able to see the distance thing. So now if you see in the left picture, the guy is very blurry behind. So that's how the myopic patient sees without glasses. The second part of the refractive error is the hypermetropia. Here, the near-sightedness, near vision is better, and the patient is, or the person is not able to see, a particular intermediate distance. The third is the astigmatism. Here, the shape of the eye in such a way that the rays are scattered and not getting focused on particular place in the retina, and that's why the vision is all, kind of a distorted vision. So these are just the three things that I wanted to give you a brief about, which are like commonest problem we see with the glasses. The myopia, hyperopia means plus number, as well as the astigmatism. Now, the most of the people go for the LASIK to remove the glasses, or they are not able to maintain the contact lens, or they are not able to tolerate the contact lens. So what are the options we have? That's what we are going to discuss today. So the laser vision correction contains mainly three aspects. One is the photorefractive keratotomy, which is called PRK. Second is the LASIK. LASIK is the short form of the laser assisted in situ keratomiliosis. It's difficult to pronounce, so that's LASIK is the commonest word that we all hear since years now. And third is the SMILE. We'll go in details one by one about all these aspects of the LASIK laser vision correction. The fourth one is the implantable phakic contact lens, and the last one is the refractive lens exchange. So all five aspects of the laser and contact lens corrected vision we will go in detail one by one. So now the LASIK is the commonest surgery performed in the world for the eye. Okay. Now if you see myopia, hyperopia, the plus vision, minus vision, astigmatism, all three patient or person can go for a LASIK surgery. The person must be having age above 18, that is the bare minimum criteria for the LASIK surgery. So what happens, LASIK surgery reshapes the cornea to enable the rays coming from far to get proper focus on the retina. That's how we get the clear vision. So everybody asks why to go for the LASIK, what are the advantages and disadvantages of the LASIK. So the most biggest or the commonest advantage of the LASIK is the pain-free recovery within a day and get the glass-free life within a day. That's the most common advantage of LASIK surgery. There are few disadvantages. Dry eye, sometimes patient may feel halos and the starburst around the light. There may be a slight decrease in the contrast sensitivity, especially in the night time. There is a manipulation of a normal part of the eye that is called cornea. The flap is created on the cornea. These are the few disadvantages of the LASIK surgery. Now, let's start from first step. So this particular machine is called Pentacam, oculizer Pentacam. So what it does is, it just measures the shape of the cornea. That's where we are going to perform the LASIK. It checks the front surface of the cornea, it checks the back surface of the cornea, it checks the thickness of the cornea, it checks the width of the cornea, also the depth inside the eye. So all these parameters are most important whether to go for the LASIK or not. So the one particular scan, the Pentacam, is considered as the gold standard before performing any laser vision correction on the eye. So this is how the Pentacam looks. These all are a kind of maps which comes out of the Pentacam scan. But what we do as a doctor or as a clinic, as a hospital, we evaluate the patient, because LASIK surgery itself is a very smooth and very short surgery. But important aspect of the LASIK surgery is to ensure the safety profile of the particular person, because the person is having a normal vision with the glasses. So as a hospital, as a doctor, my job is to ensure that the particular person, if undergoing the surgery, gets the accurate and the 100% vision without any risk. So for that, we have to work little bit on the surgery, pre-surgery. The planning and everything should be done properly. So what we do is, we do first of most important thing is the dry eye evaluation. So because LASIK surgery cause a lot of dryness later on, so we evaluate the dryness level of the eye. If there is something related to dryness on the surface of the eye, we treat it first and then go for the surgery. Second is dry and dilated refraction. So refraction means we check your power with your specs, without your specs, then we instill some drops to relax your muscles inside the eye, and we get the actual power of the eye. We cross-check the power of your glasses 3 times before planning to go for a LASIK surgery. Third step is the retina checkup. Retina checkup is basically the back support of the eye, the film where all the images getting created. So what happens, sometimes there are some weak points which is by birth also. These weak points we need to screen and treat first before going for any laser vision correction or the LASIK surgery. So that is one of the most important examination part of the examination for LASIK evaluation. Again, those who are using contact lens, they should stop wearing contact lens at least 1 week before doing the pentacam, so that the pentacam can check the actual shape and the curvatures of the eye. Again, the last step is the pentacam that we already had discussed. So this is the pentacam on your left side. If you see, there are a lot of axes and the numbers written on that. These are all important aspects because this all data will be transferred to the LASIK machine, and then the machine will evaluate the data and start the particular process for the particular person. There are few contraindications for the LASIK surgery as well. I mean, those who can't go for the surgery, these are the few examples. First is the irregular cornea. So it's when I say irregular cornea, it doesn't mean that the eye has an irregular surface. It's a very micro level kind of situation. Those who had had some history of injury in the past, those who have some infections in the past, they might have a different shape on the surface of the cornea. That's what we call irregular corneas. Second thing is epithelium basement membrane disease. It's like our eye skin is based on particular membrane. If this membrane is not strong enough, we can't do the LASIK surgery. The thickness of the cornea is the most important aspect for undergoing the surgery. So as I said before also, the safety margin is the most important thing as a surgeon for us, to ensure that person will have a good vision on the first day as well as after 10 years, 20 years, 30 years down the line. So for that, the thin corneas, the cornea thickness should not be less than 470 micron, and that's what we measure in the pentacam as well. If some corneas are too much steep, means if it is too much curvature on the cornea or it is too flat on the surface of the cornea, then we can't do the LASIK surgery. It's not like we can't do, it's not safe to do. The fifth one is very high myop. If the person is having more than 12 diopter of power, we avoid doing LASIK because the outcome will not be satisfactory. Some patients have very small eye. The subpalpable fissure of the eye is very small, as well as this eyebrow ridge is very prominent. It becomes difficult for a doctor to operate in such scenario, so that we avoid doing surgeries in such cases. There are some diseases called ectasia of the cornea, like keratoconus. In those, we can't do the LASIK surgery. Some other diseases like glaucoma, diabetic retinopathy, some progressive retinal congenital diseases, we can't do the LASIK surgery. Some infections like herpes simplex virus infection, we should not be doing LASIK surgery. So these are the types of the commonest laser vision correction. The first is the PRK. I'll go details one by one. The second is the standard LASIK, or the LASIK we all hear since years and years, that is standard blade LASIK. The third is the femto LASIK. The fourth is the SMILE, which is the newest version of the laser vision correction, SMILE and the SMILE Pro. The last one is the Contura LASIK. So let's go by first one, PRK. So PRK is a photorefractive keratotomy. It means we are using the laser to change the shape of the cornea without creating a flap. We also call it epi-LASIK. So we just remove the front surface of the cornea in some cases, or in some cases we don't even remove the front surface of the cornea and we use the laser directly on the cornea to reshape the eye for a good vision. The most important aspect or the advantage of this particular PRK is there is no cut on the eye. There is a extreme less chances of the dryness. Patient can resume sports activity very early. Good visual results after few days. The people who are into the sports, those who are going for army or navy, there where they have a chances of a combat, hand-to-hand combat or any kind of injury-prone area, we advise this PRK because it doesn't create any flap on the eye. So the patient is always having a risk-free sports journey or the military journey. So this is how the procedure is being done. If you see, we just use some clamp to open up the eye. We numb the eye with a topical solution. So there is no injection or anything. The eye is focused on the center of the machine, and then you see the laser is just correcting the vision, and we just wash out that particular eye with some normal saline. So this is just the simplest procedure one can have in the eye, and the vision will be absolutely fine within a 2 or 3 days of time. We use the contact lens after the surgery just to give a comfort or soothing experience after surgery. The second, the commonest one, time-tested one since many years that we do is LASIK, the blade-assisted LASIK. In this, we use a specialized automated microkeratome blades which cuts the cornea and create a flap in a particular design manner, and then we use the laser to correct the vision, and then we put the flap back on the eye. The most important is the fast recovery. In this LASIK, the recovery is very fast. There is no pain and resume activity within a day or two. Let's see the video for that particular LASIK. So this is how the LASIK surgery, the blade LASIK is done. We open the eye with the clamp. We put a particular ring which creates a vacuum on the cornea, which is absolutely painless. It looks like something is touching the eye, but actually your eye is numb with a simple drop and the eye is not feeling any pain. Now this is a particular automated blade. It's completely automated. It goes forward, goes back in just 3 seconds, and then the flap is created on the eye. So after using this blade, we lift the flap. We'll see now how we lift the flap on the surface. You see a very thin slice of the cornea is lifted. This all is so simple and without any pain. Patient will not feel 1% of pain during this particular procedure. After creating the flap, we put the flap little bit away from the center of the eye and we do the laser surgery. After that, we just give a thorough wash on the eye and then we put the flap back. That's how the surgery is completed within hardly 30 seconds. So now this whole procedure is done. You just see the alignment of the flap and remove the excessive water on the surface of the eye, and patient is done with the surgery in 30 to 40 seconds max. This is the LASIK shoot that if you see the machine is advanced machine, which the patient is given the position particularly on supine position just below the laser machine, and it is so comfortable. This whole system is automatic, so you don't feel any kind of glitches or hitch during the surgery and after surgery. Even we remove those clips and everything. Now the latest advancement of the LASIK is the femto LASIK. So many patients will come to us and ask, What is bladeless LASIK? So the bladeless LASIK is basically the femto LASIK. What we do in femto LASIK is, in the previous surgery, we use some blade to create a flap. Here, we are not going to use any blades to create a flap. There is a specialized laser called femto laser, and this femto laser will create a flap on the eye without using a blade. So the safety margin of the femto LASIK goes way higher than the conventional LASIK, just because we are not going to use any blade, so the blade related complication goes zero. And in femto LASIK, we just create a flap by using a specialized laser. We lift the flap and then the same process like what we did in the LASIK. The biggest advantage is no blade. Everything is laser. To create a flap and to do the laser correction with the laser, it's all robotic. The precision is so accurate that the chances of complication is almost near to zero. Recovery is the fastest in this, as well as the long-term outcome. The chances of long-term complications and everything is completely nil in the femto LASIK. The last one in the laser procedure, what we call is relaxed smile. So just imagine, I'll just show that we created a flap on the eye for most of the patient. We create a flap and then do the correction and then we put the flap back. And this particular surgery, we don't even create a flap. We just create a lenticule, a slice of the cornea inside the cornea with the use of laser, and we just pull it back. That's how the relaxed smile is done. So there is no blade, there is no flap. So it's a flapless, bladeless LASIK. This is the most, the advanced LASIK in the world. It just hardly takes 8 seconds in the newest version, the Smile Pro, to correct the vision. So the smile surgery is the safest one for now. There is no chances of creating a dryness on the surface because we are not creating any flaps on the surface. Everything is artificial intelligence based, everything is robotic. All we need to do is to do a proper evaluation before, as we discussed, and we transfer all the data to the machine. Machine will evaluate every data and then create a specialized version of the treatment for the patient, and when the patient goes for the surgery, hardly it takes 8 seconds for one eye, 8 seconds for other eye, and the patient is done for the surgery. Now, I want to emphasize something on word called contour LASIK. Many now, because of the social media as well as now lot of awareness is going on around for the LASIK surgery, we all hear about contour LASIK. So what is contour LASIK? So what we do is, this is a particular high-end precision scanning of the cornea. So we discuss about minus number, we discuss about plus number, we discuss about astigmatism, we discuss about irregularities on the cornea. There is one word called higher order aberration, the aberopia. So the aberopia word was coined by Dr. Agarwal himself, our chairman. So the aberopia is basically, if you compare the TV, there is a 4K vision and 8K vision and kind of, ultra 4K vision kind of vision. So this higher order aberration is the finest irregularities on the surface of the cornea, which we don't see with the naked eye. So the pentacam just capture all those micro irregularities of the surface of the eye. We take all these particular data and put it in the Contura software, and the Contura software will create a fine tuning of particular patient's eye to have a very specific and specialized treatment for particular eye. So just assume that everybody has a different fingerprints. So the Contura will create a different fingerprint kind of treatment, protocol for each eye, and every particular person will be given a precise treatment. So the Contura is nothing but a very precise treatment to give clarity of the vision, not only for minus and plus number, but also for higher order aberration. So we use the word supervision. So the Contura LASIK give us the supervision, although we don't promise that. We always tell that we will have a freedom of the glasses, but all the patient comes to us and tell us that the vision is improved beyond the glass vision what they had. So, when you see the abrasion, it's very simple thing. You don't notice in the day-to-day activity, but this is how it looks on the day-to-day activity when we drive in the night. So if you see the moon surface, there are we can see the moon very beautifully, but when you go in details, there are some ups and downs on the moon as well. It's the same thing happens for the eye. Our eye has a different micro unevenness on the surface that can be countered with the contour trademark vision. So this is how the pentacam collects the vision. Just imagine our eyes 11 millimeter and 11 or 12 millimeter complete diameter of the eye. In that 11 by 11 millimeter, these particular scan takes 22,000 images and 22,000 points, gathering all those images and create a specific version of the treatment for a particular person. So this is the most precise way of correcting the vision. So what are the things we have to do after LASIK surgery? These are the few things that I will always suggest that you rest for a day or two. It's not like we always have a good vision very next day, but always we have done something on your eye. Let's rest for at least a day or two. There may be a mild burning or itching or kind of irritation on the surface of the eye that is temporarily. After a few hours, it will just disappear. Eyesight may be blurry for a particular day, but once you have enough sleep for one day and then next day once you wake up, it will be completely normal. We try to advise and avoid strenuous exercise for at least a week. Try not to lift a lot of weights. Avoid rubbing the eye, that is very, very crucial. Avoid head bath for at least a week. That's how these are the few things that we avoid for the recovery of the LASIK surgery. So, what are you likely to experience after the procedure? Many patients will always have, that apprehension we will have. So, these are the few things that I would like to highlight. There will be some mild to moderate kind of watering from the eyes. Every individual has a different eye. So, you can't compare that my friend has this problem and I have this problem. It's a different. So, individual depend on every individual. They might feel a mild to moderate watering. They might feel some sensation that something is gone inside the eye for a day. Sometimes the white portion of the eye may show some red spot or blood spot that is going to disappear within a 3 to 4 days max. It's not something to panic about. Sometimes you feel sensitivity to the light when you see the bright light on a very first day. First day of the vision, you might see hazy, so don't get worried about that because it's the part of the recovery. Within a 24 hours, the vision will become super clear. We give post-operative medications like antibiotic, very mild steroid just to heal the eye. We give rest at least for 42 hours to 48 hours. We advise not to rub. I again discuss that. We give a lot of lubricating drops along with this to give comfort of the eye. So now what you can expect after the LASIK surgery. See, the laser vision surgery offers so many benefits and it dramatically changes the vision within 24 hours. Most of the people will achieve 6/6 or 20/20 vision just immediately in a day or two. But these results may vary. It's not that every eye is the same. It's not every person has a same particular eye, the strength of the eye. So some might get 20/40 vision, but that is also a normal vision. 20/20 and 20/40 is also considered as a normal vision. So don't get panic because your eye might be different than someone else. So you don't have to compare your eye with someone. You just have to see how comfortable you are with the vision without glasses. That's the goal of the surgery. If by chance, if there is mild residual refractive power after LASIK surgery, if you feel that the certain activities are restricted with this particular, a few leftover power, we might need some touch up after 3 to 6 months. We might suggest you to use some dark goggles in the daytime during the strong sun and anti-reflective correcting glasses in the night time for few weeks to few months. so that you get used to this particular problem. It's not like that after doing surgery you are not going to use glasses for some problems. Every individual will react differently. So if you require some corrections, yes, it can be done. If you require some glasses for a few weeks to few months, we can suggest that. But overall, your life will be completely free from the glasses. There are few chances that you may get some infection. That's why we tell all the patient not to touch the eye, not to rub the eye, not to take the shower from the head for at least a week to avoid the infection. As I said, the touch-up may require in few patients. When you become 40, you may require reading glasses, because the near vision is different subject, different prospect of the vision. Our eye has a focusing ability inside that goes down by 40 and 40 onward. So that's where we require reading glasses. So LASIK surgery doesn't clears the reading glasses. It just clears the distance glasses. For reading, you always need glasses after 40, 42. That's why we always tell the best age of doing LASIK surgery is 19 to 22, because then you will have more than 20 years to enjoy life without glasses. Anyway, after 40, you are not going to use glasses for distance, but for reading, you might require glasses. So patient should instill the drops, again clean the margins with the wipes, normal food, normal activity. They can use TV, mobile phone and everything after the second or third day. They can resume computers after third day, can cook in the kitchen with the protective glasses after a week or so. After that 1 week, they can take the bath. We give a sterile wipes to use to clean the eye. We always suggest not to use makeup at least for a month to avoid, that particular goes inside the eye, especially in the eyelid and all those stuff. Try to avoid dust for a few days, as it is very important to prevent the infection. Try not to rub the eye again and again, I am saying, because rubbing is not good at all after surgery. If you feel that vision is little bit blurry after second or third day, you can just blink out for a while, then the vision will become clear, because sometimes after a surgery for 5 to 7 days you might feel dryness, and that will be cleared with the blinking itself. Do not go to swimming pool at least for a month. Cosmetics again for a 1 month. Exercise you can do after a week, but try to avoid lifting a lot of weight. Don't drive at least for 5 to 7 days, so that you become normal. I mean, you don't face the halos and starburst when you drive in the night time. We see the patient on the first day after the surgery, 7th day after the surgery, and 1 month. Most of the patient again resumes the work on the 5th day of the surgery. So if you see this implantable phakic contact lens that what I have mentioned before, so now not all the patient will have the suitability for the LASIK surgery, or not everybody will have a eligibility for the LASIK surgery. So what we do is we implant a specific material contact lens or columnar lens inside the eye to correct the vision. So this particular person has -14 and -15. Now, as I said, that the LASIK can correct up to 12. So what we can do for this patient? So what we have done is we implanted a specific specialized lens, and then patient can see without glasses. So those who doesn't fall in the category of the LASIK surgery can go for this ICL treatment if the power is too high. And the biggest advantage of this particular procedure is you can go up to higher power, plus it's reversible. If you are not happy, or if you want to get rid of these things, you can just remove it out, and then you will have a vision with glasses what you had before. The newest emerge in the laser vision correction is refractive lens exchange, RLE. So what is refractive lens exchange? So some patients are extreme high myope, like -20, -25. In those cases, we can't even use the contact lens, the one that we implanted for this particular patient. Those who have very high plus number, on those also we can't implant the lens and we can't do LASIK surgery. Those who are in 40s and want to go for a glass-free life, for them the refractive lens exchange is important. So as I said before, that the eye has three aspects: the cornea, where we do the LASIK surgery. The second is the lens inside the eye, middle part of the eye. We remove this natural lens earlier and we put a specific specialized lens in that particular area to give distance, near and intermediate vision. That is called refractive lens exchange. So for the younger people, those who have extreme plus or minus number, they can opt for this refractive lens exchange. Those who are in 40s and want to get rid of the glasses and doesn't want to even use the near vision glasses, they can go for a refractive lens exchange. It's completely safe. It takes hardly 1 or 2 days to get recovery. Patient can resume all the activities after a week: exercise, cooking, going out, all the activity like LASIK. And it's this one of the easiest way to do the surgery. And also it is done without any anesthesia also. So these are a few patients. If you see, both the doctors, on the left side, the doctor is one of my friend's son.
Hi, this is Dr. Parth Sawan, and recently I have done LASIK surgery from Aditya Jyot Hospital, and I am very happy with my results. All thanks to Dr. Smith, who has done the surgery very effortlessly and without any complications. And thank you, Aditya Jyot Hospital, for this wonderful experience.
I would like to thank Dr. Smith for giving me my complete vision. I feel very, very free after 25 years of wearing specs. My power was minus 22 and now it's zero. He did magic to me. I visited complete India for my eye treatment. Nobody was ready to operate me for my complications. But then finally I visited Aditya Jyot Eye Hospital and there I met Dr. Smith. And he has done magic and beyond words. Dr. Smith has a very, very fine space, very fine surgical space. I'm highly impressed. He's very kind-hearted, very humble, and a very good doctor. I would recommend everyone to visit there. He had made me comfortable during my surgery. He was telling me the procedures and he was telling me when I'll feel the pressure. So he was very kind to me and very, very great ophthalmologist. Thank you so much, Smith sir. I'm so grateful that I met you and I will recommend everyone and I'll always remember you in my prayers.
So these particular testimonial I wanted to share because if you see one guy who is also a doctor and undergone the LASIK surgery and he is completely fine. The second person, that lady doctor who had minus 23, 24 power in both the eyes. Just imagine your life with 23 power on the face. You hardly have a very very jack in the box vision, and you can't do any activity without glasses. You are completely dependent on the glasses. Everybody must be wondering, if I have done the surgery, why she is still using glasses. That glasses is just the anti-reflective glasses that she decided to use just because since 25 years she has used the glasses. So both the patient has a different indication for the surgery. The first one, they wanted to get rid of the glasses just for a cosmetic as well as the comfort reasons. The second one, the reason behind the glass or glass removing surgery is to give a independent life from the glasses. These are very important points because the moment you wake up and when you have 10 numbers, 12 numbers, 8 numbers, first thing you do is to just grab your glasses in the morning and then start your day. That is called dependency. If someone has 12 numbers, 15 numbers in the eye, you can't confidently walk on the road if your glasses are broken. So this is called dependency on the glasses. That's what we have broken out for the lady, and now she is pursuing the postgraduates in her field, I mean medicine itself. So these are the two aspects of the vision correction. For the particular person, the boy, we have done a femtocontural LASIK. Without any pain, we did the femtocontural because the number was less. In this particular lady doctor, we did a refractive lens exchange because power was too high. Even it was not possible to correct with the laser as well as the ICL. So we decided to remove the natural lens and replace it with the artificial lens inside the eye. This is the different scenario that we create a tailor-based therapy for individual eye, not individual patient itself. One eye is different than other. Now everybody is wondering, I am doing surgery for doctors, then why I have not done the surgery myself? So there are few things we have to understand. LASIK surgery is the most safest surgery for anybody. But if your cornea is not strong enough, then we should avoid doing it. So as a doctor, as a Agarwal's group, for us, the most important aspect is the safety first. We just don't do the surgery if we feel that the safety is not there. If we feel that we are taking even a 1% of the risk for patient, we will avoid doing surgery and advise. My cornea is not having enough thickness to undergo. So I am not the privileged one like the patient I have. So I can't go for the surgery. The thing about ICL and everything, as I am approaching near 40, I will have a near vision problem in a year or two. So my age has already gone. By the time I got my post graduation and everything, I already crossed 30. So it's best time to go for surgery between around 19 to 20. I'm not saying that 30 is not the good time to go for surgery, but we always try to do surgery early so that we have a long gap to enjoy freedom from glasses. So those who have privilege to go for surgery, please go for that. Not everybody is privileged like you, because I'm the one who wants to go for surgery, still I'm not able to go for it. Even my mentor, Dr. Vanna Jain, did her own, someone did her laser surgery 15 years back. So you can understand, doctors who are eligible for surgery goes for surgery. Those who are not having that eligibility criteria, they will avoid doing surgery in their eye. And we also follow the same for our patient. We don't just do the surgery just for the sake of the surgery. We clear all the aspect of the safety first before even touching the eye, because we are dealing with the normal eye. Your vision is normal with the glasses, means you are a normal person. Now we can't take the risk and after surgery, after a few years, you end up in some different situation. So that's where the post pre-operative importance, evaluation importance is very, very crucial for the LASIK surgery. So if you have any questions, any doubts, I can open the floor for the question answers. Kavita madam, over to you, please.
Yes, sir. Thank you, Dr. Smith, for the wonderful presentation. We are now opening the chat section for the questions. So if you have any queries regarding about LASIK or the procedure or anything you'd like Dr. Smith to address, please feel free to write it in the chat box. So we'll be reviewing your questions, and Dr. Smith will answer as many as the time permits. Don't hesitate to ask anything about eligibility criteria or post-operative care or the risk or any concerns that you may have. So while we wait for the participants to write the chat, we have few questions with us which patients had given while at the time of registration. So I'd like Dr. Smith to address them. So Dr. Smith, the first question is, what are the risks involved with LASIK?
So I already mentioned that the commonest, surgery itself is very risk-free surgery itself. But to make it more extra risk-free, we do a lot of hard work pre-operation. We call it pre-operative evaluation. But still there is huge chance of complications or the risk after surgery is the dryness, which is the most common because we are just changing little bit on the surface of the eye. But let's say out of 195 patient will come out of the dryness in a year or so. So that's the one risk. Second, sometimes some patient will feel the halos when they go out in the night time because the light may changes in the particular edge of the flap. So in that aspect, the smile surgery comes in the picture to avoid the halos because we are not creating any flaps. But these are the two risk factors associated in the recovery aspect of the surgery.
The second question is, what happens if I blink during the LASIK surgery?
Yeah, so see, when we undergo any person, it's including myself or anybody, if they are undergoing any kind of simplest procedure, they are always under apprehension, and then we understand that particular problem. So during the surgery, we use a particular clip to open the eye. So I can't, your eyes can't blink by its own. Also, we have put some numbing drops on the surface so you don't feel what we are doing. So what happens? We blink when we have something on the eye, something touches the eye. Plus, we have already opened the eye with the clamp which is locked. So you can't blink actually. We always suggest that try not to get apprehensive during surgery. Just the 30 seconds, but yeah, we have to, as a surgeon as well as a patient, it's a joint hand venture. We both have to be in a calm atmosphere during surgery. As a doctor, we provide all possible ways to calm the patient's apprehension and nervousness, but the blinking doesn't affect anything. If you blink or move the eye, the machine automatically stops throwing laser in that particular moment. So now our machines are so advanced, so artificial intelligence based techniques involved in this particular procedure. If your eye moves even for 1 millimeter, the machine will not throw the laser in that particular second. And then again, once you are centered, the machine will start automatically. So that's how blinking is prevented by the clips, as well as the machine also takes care of the movements.
Right. So we have a question from one of our viewers. The question is, among different types of LASIK procedure, which one do you recommend to the patient with -6 power?
If it is -6 spherical power, then you can go for contura femtolasic as well as the smile surgery. But all depends on the thickness of the eye. The pentacam gives me the idea what is best. So I can answer that this is best for you, but once I do the scan, it will give me the exact idea what is best possible for, so that I can tailor make the things for you. Okay, this is best for you first, second, third. So ideally -6, you can go for all the surgeries, smile, femtolasic, contura, everything. But that all depends on how thick your cornea is, what's the shape of the cornea is.
Yeah, I understood. Hope it solves the query for the person. Next question is, how much time does it take for the checkup?
Yeah, so once you register from desk, my consultation or any other doctor consultation will take at least 15-20 minutes. After consultation, we do 3 tests, as I mentioned before as well. One test is called dry eye evaluation. Second is pentacam. This takes just hardly 15 minutes. The third important test is the dilatation of the eye to view the retina. So we put dilating drops in the eye that takes 30 to 40 minutes to work. After that, our retina specialist doctor will do a thorough examination of the retina. So it takes at least 1 hour to 1.5 hours to do a complete, holistic approach, evaluation for a LASIK surgery. So also we put the drops to determine, what actual number is in the eye. So from registration to complete evaluation, which will take at least 1 hour to 1 hour, 15 to 20 minutes. That's the bare minimum if we want to evaluate everything, because we can't rush the things before surgery. That's the most important aspect of the LASIK surgery.
Correct. Another viewer has a question. I am 45. Can I do this?
Can I do?
Can I do the procedure with
Yeah, so
45 age?
if you have a distance vision problem, I mean minus or plus number for distance, that can be corrected with the LASIK surgery, any type of LASIK surgery. So that's not a problem. It's not the age barrier. But if you are 45 and if I remove your minus power, then again you will require reading glasses. So what we recommend after 40, we recommend refractive lens exchange so that I can take care of your distance vision and near vision as well. And in a true way, I can give you a freedom of glasses. I can do LASIK also as per the requirement, but actual way to do after 40, 45 is the refractive lens exchange. 100% safe and fastest recovery, like a day or two, patient will be completely glass free for distance, near, and this particular vision will remain same throughout the life. Now after 40 years, 30 years, it won't change. So yes, after 45 you can do, but again I need to see.
Wow. Can you one more question? Can you explain about the ASA treatment and how it works and disadvantages?
Sorry?
Can you explain about the ASA treatment? It's just written a short form. I'll take the next one. Another viewer is asking, I am 35 and my left eye has a -4 power. Which LASIK is perfect for me?
Smile. If you have a -4 plane power, there is no question. If you, smile is the first category I will suggest because there is least complication, and also the femto contura LASIK. So we combine femto LASIK with contura technology that is also equivalent to the smile itself. So once we do the scan, we get the idea whether the patient has higher order abrasion or not. But if it is simple spherical power, both of them are equally good.
One more question. Hello, I am 30 now. If I get surgery now, what about when my age turns to 40 or 45 plus? Will I need to again attempt eye surgery in the eye surgery? Will I face any eyesight vision issues after 40 or 45? Currently, the patient age is 30.
30. So 30, we can do the LASIK surgery at 30, 31 as well. There is no harm or there is no risk involved in that. Once you reach or cross your 40s, you might require reading glasses. Now, imagine that after a few years of using reading glasses, if you are not comfortable of using reading glasses also, we can also do a refractive lens exchange at that particular age as well. So yeah, first you go for a LASIK surgery if you want, absolutely no harm. You can try with the glasses for a few years, and if you are like, no, if we don't want to use glasses for reading as well, then again we can give option for refractive lens exchange. We can't do anything apart from that for reading glasses.
Can the dryness issue can trouble you a lot in a day-to-day activity?
So it's a very individual aspect of dryness. Every individual will have a different level of dryness after the surgery. So what we do is immediately after surgery, we give lot of lubricating drops for at least 1 month or 2 months so that the chances of dryness goes down even in the later phase of the life. Even if after doing all the prospect of dryness correction, if still patient is having dryness, then we suggest using some lubricating drops at least twice or thrice a day. It will make sure that you will not feel the dryness, because it's like not everybody will require a moisturizing cream on their skin, and somebody will require moisturizing cream in summer itself. So every eye or every person is different. So dryness level, how it will be in a particular person can't be determined. If a person is having dry eye before surgery, so what we do is we treat the dry eye completely first and then take the patient for surgery. We don't do surgery at first go if the dryness is there before operation. And if someone is having high chances of developing dry eye, then we give them particular options to opt for the best possible surgery.
Right. Another question, a user has mentioned that thank you for the insightful session. The patient is 37 years old and has a myopia and astigmatism with minus 6.75 and minus 6.50 eyesight. Kindly advise whether I can do it now or as previously it was suggested all the X-ray and test to do femto LASIK.
So we can, this kind of particular high power, if the cornea is good, thick enough, we can go for a contour femtolesic correction if the astigmatism is still there, there also. So contour femtolesic is possible, but you are 37, so after 3 years or 4 years you might require reading glasses. We can leave a little bit of minus power in one eye just to tackle that problem of reading. So as I always use the word, we tailor-made the therapy for a particular person. We use both the eyes vision to ensure the freedom of the glasses for more years if we are doing something. So we understand the requirement of the person, daily activity, if someone is driver or if someone is a reader, if someone is a lawyer, so every aspect of their daily routine we need to understand. After that, we create a particular protocol that, okay, we can do this for your right eye and this is for your left eye to ensure that you have a complete glass-free vision for distance as well as for more years for near. So, these things can be done. If you want to get straight away for the distance vision, we can do it immediately. There is no harm.
Right. So one viewer has asked that I am 69 years old and got glaucoma for 9 years. Want to know what kind of treatment you have got for that?
Now for glaucoma, all the possible, because now we have the center for the eye stent as well. It's a LASIK webinar, but still I'll just give because the viewer has asked. The eye stent we have now, that's the most advanced surgery for glaucoma available at Agarwals Eye Hospital. That's the tiniest implant a human body can have, and that can be implanted in the eye.
Another viewer has asked, hello doctor, I have vision issues in only one eye. There is minus 4.75 spherical and no other medical conditions currently. I want to understand which surgery would be best for long-term safety, contour vision or smile, especially if I develop diabetes later in life. Kindly guide which option ensures better clarity and future eye health.
Okay. So if only one eye is involved with the power, let's say, in our testimonial also there was one patient who has minus 15 in one eye and 0 in other eye. So,
Okay.
So we put ICL in that patient because it was minus 15. So it's not, uncommon. We see many patients who has power only in one eye. So what we do is the best possible treatment for that one particular minus 4 number is, if suitable, then the smile is the first option. Second is the contour LASIK, femto LASIK. Diabetes directly doesn't affect the laser surgery. It has no connections with the laser surgery, but diabetes has effect on the retina, the back part of the eye. So if diabetes is uncontrolled, the retina gets affected and the vision can go blurry. So it's not connected with the LASIK surgery itself. It is basically diabetes affects the back part of the eye, retina. Also, diabetic patient has a tendency of developing the cataract in an early age. So these are the two things which is completely separated from the LASIK surgery. So if you have done LASIK surgery, it is not related to diabetes or anything. It is completely independent, but other two things can affect the vision if the sugar is not controlled.
Right. Another viewer has a query. My right eye is plus 11 and left eye is minus 7. Is LASIK possible? Note that in my right eye, lenses is removed due to eye injury. Is LASIK possible for both eyes?
So plus 11, it means that the lens inside the eye has been removed. So what we evaluate is whether this plus with, if I put plus 11 number of glasses and if patient is able to see, again, this particular patient requires glued IOL. Blue dye oil is again our own intervention. So what we do is we insert a specific lens in particular place and fix it with the glue inside the eye so that the lens will give you a vision without glasses in right eye. That is blue dye oil. The second eye, if it is -7, we again evaluate. If suitable for the LASIK, yes, we can go for the LASIK surgery. No harm in that. So both eyes can be corrected. One is altogether a different surgery that is called blue dye oil because of the past history of injury and the lens has been removed. If the retina has the enough strength, if the person is able to see with +11, he will see with the blue dye oil. That's how it is. If the person is not able to see with the +11 glasses, then the surgery will not help us.
What precautions should I take post surgery?
The most important is not to touch or rub the eye. Use the medicine on time as advised. It is very important. Try not to lift the weight or do exercise for at least a week. Use the gadgets and the screen mildly on first day. After 5 days or 4 to 5 days, you can use the routine computer and laptop as much as you want. Try to avoid cooking for at least 5 to 7 days. Also, no swimming for 1 month, no makeup for 1 month.
Went on mute, sorry. How do I know if my cornea is thick enough for LASIK?
We need to do a pentacam. So pentacam is the first step for any laser correction surgery. The most important or the gold standard test. So if I'm not doing pentacam means I'm taking risk for my patient. So I always suggest pentacam is the most important. Pentacam, once we do, we understand the thickness of the eye and then we determine what kind of LASIK is best for them.
Right. Another question, what are the chances of needing glasses after LASIK?
So there is a word called regression, which is rare, very, very rare. It's like once I operate, let's say 10,000 people, hardly 2 or 5 people will get the regression. Regression means after a year or so, patient might get -1 or -1.25 power. That is the natural shape or reshaping of the eye, which is beyond human control, but which is very rare also. So in such cases, we observe the person for a few months again and again to see how much it is going. Once it is stabilized, again we can do a touch-up according to requirement and then we recorrect that regression as well. But which is very rare.
Right. Get that. How much does LASIK surgery cost and is it covered by insurance?
Cost and insurance, you can always, my team will connect with you and they will give you all the details regarding all those financial aspects. They will also help you to understand the involvement of the insurance things in that. They will connect you personally and then give you all the details.
Right. Can I have a LASIK if I had a previous eye injury or an eye surgery?
Very difficult. Depends on where the injury was, what was the extent of injury. If the cornea is affected and there is a scarring on the cornea, we avoid LASIK surgery. So we don't want to do or create any more complications in the injured eye. If the injury was minor in the past and it has not affected the cornea, then we can think of doing LASIK surgery, no harm. But if the safety margin is going down, we will avoid LASIK surgery in such cases.
Dr. Smith, can LASIK be done after pregnancy or during breastfeeding?
Very excellent question. So what happens during pregnancy, or during lactation period or breastfed mothers, the power goes up and down little bit. I mean, it may vary points 75 to 1 during and after pregnancy for at least 6 months when the mother is breastfeeding. So we avoid doing any procedure during this period. Once the mother is completely out from the lactation, at least we wait for 3 to 5 months before we opt for the surgery. So during this 1.5 year of tenure, we avoid doing surgeries. We recommend not to do surgeries because the predictability is very less. So yeah, better to avoid surgery in such period.
Do I need to stop wearing contact lenses before the checkup or surgery?
Yeah, so once we are planning a LASIK surgery, once I'm doing pentacam, I want a contact lens free eye at least for 1 week, so that pentacam actually judge better way. So we avoid contact lens 1 week before doing the scan. That's how we plan now.
Doctor, is it true that LASIK can make my eyes weaker over the time?
No, it's not true.
And one last more question we'll take. Does LASIK increase the risk of cataracts later in life?
No. LASIK is completely independent from process inside the eye. Cataract is basically age-related change. You know, when you grow, it becomes opacified. So LASIK doesn't have any say on the cataract at all.
Yeah. Thank you, Dr. Smith. Thank you, Dr. Smith, for the wonderful session. I hope the participants now have a clear understanding of how LASIK helps to get you rid of the spectacles. So before we wrap up, please understand that you will, all the viewers will receive a WhatsApp message shortly on their registered mobile number confirming their eligibility for the free eye LASIK checkup and any of the Dr. Agarwals Eye Hospital in Mumbai. So you can show this message at the reception counter and get your offer availed. If you have still any further queries for Dr. Smith, if we have missed any queries from the chat box, please feel free to call us on the contact number, that is 9833-500-580 at Aditya Jyot Eye Hospital. I'll repeat the number. It is 9833-500-580 Aditya Jyot Eye Hospital, where if you have any queries, Dr. Smith will address your concerns. Thank you once again, Dr. Smith, and we look the participants to visit our hospital very soon. Thank you.
Thank you.
Thank you, sir.